This program is presented by University of California Television. Like what you learn? Visit our website or follow us on Facebook and Twitter to keep up with the latest UCTV programs.
Okay, I know many of you have stayed, and this was a very difficult decision. As Terry said, we received over 30 projects. We had a webinar to assist in the development of these projects. We also, we have provided a group of 6 health policy researchers, very well led by Michael Ong of UCLA, including Steve Shortell of Berkeley, Andy Auerbach of UCSF, Pat Romano from UCLA, Shelley Greenfield from Irvine, and Ted Ganiatz from San Diego. We made available these wonderful health policy researchers to help improve the applications of anyone who wanted to, because this is not about competition. Again, in the new spirit of collaboration, we wanted the very best projects to be able to be put forward, and we got them. And while we know there will be some disappointment, I do want to say that we hope there will be another round. I leave it to my partner, Terry Kilhorn, to make the decision about another round. There was a decision, a strategic decision, to fund fewer multi-site projects than we might have wanted, but this had to do with some strategic imperatives from the board and from the operations committee, given how many performance improvement projects the campuses are undergoing. So what I'd like to do is start with our multi-site projects, and if I could ask you to hold applause, and I know that you've been waiting, many of you, for many months, and as I have finished announcing the multi-site winners, if I could ask the 3 representatives for these projects, because I know not everyone could fly up for this, to stand behind me, and then we'll take a picture with Terry and I at our 3 multi-sites. In no particular order other than alphabetical, we want to congratulate Dr. Lau from UCSF. Is Dr. Lau still here? Please come on up. And congratulations, Dr. Lau has provided a standardized protocol to improve patient safety for our neurosurgical patients throughout UC Health. And we just want to tell you how proud we are of your effort. And
I also have a co-investigator. Can we also bring him up
a co-investigator, you absolutely can.
Dr. James Harrison.
If Dr. Harrison,
Yes,
and that's that kind of partnership and collaboration, so thank you for that. And congratulations. These multi-site projects, because we reduced the number, there was unanimity, and we don't get unanimity between the lawyers, the nurses, and the doctors always of our system. Okay, and I know that we have somebody coming up on a plane, and so we may have another individual or individuals receiving. Dr. Stamos from UC Irvine. We're very proud to be able to award this project to reduce the risk of harm for our high-risk colorectal and rectal surgery patients. And coming up is Lisa McLemore from UC San Diego, who is one of our fellows from last year. And so what we're seeing, and frankly, Lisa, can I tell a little secret about when we did this RFP and I didn't get a phone call from your group and I knew there was already a collaborative in existence, I said, where is your project? So, and we're just so excited that, so congratulations for all your leadership and the leadership of your entire group. And we know Dr. Stamos couldn't be with us. Our third and last multi-site project, meaning 5 campuses, is Francesca Toriani, still here, from San Diego. Come on up if you are here. Where is she? Ah, there she is. Amy, now I see that's you, and I love that excitement for the whole infectious disease collaborative. We are so excited and so proud, Francesca. This is a group also that has been meeting for a really long time, and it's been such a privilege to participate in the collaborative of our infectious disease professionals, both nurses, doctors, and they care so deeply about the patient. Can we have them up? Absolutely. Come on up. This is about interdisciplinary care. Amy and the rest of the interdisciplinary ID teams, come on up. I know you all helped write this. This is a project that will create standardized bundles to reduce surgical site infections throughout UC Health and several service lines. And I want to thank Dr. Toriani that when we called to say, can you add another service line? And you'll get the collaboration of our colorectal surgeons. This is a ready-made collaboration. We thank you for your willingness because, of course, we don't need more duplication or more silos. So I'm just delighted. I know Terry is delighted. And if we could have a picture, and now we can applaud. So a year from now, when you come up to the colloquium to report, we don't want to wait till then to learn about any impediments or difficulties. Everybody in this room is behind you. We reduced the number of multi-site projects because we want to be able to support these projects and do all that we can. You have the full support of the Office of Risk Services. You have the full support of the Office of Health Sciences and Services. So please don't let us know a year from now if you ran into difficulties with implementation. Everyone here wants to support you. So thank you so much. Okay. So what we did with single site projects, some of the individuals who applied for 5-site projects, they scored very well. But for a variety of reasons, there was concern about the system's ability to integrate a 5-site project. And so the applicants in those cases were called and asked if they would be willing to accept funding as a single site project and then reapply. And we hope to learn, part of what we're trying to learn is what are the barriers to spread, but we don't want to overwhelm our ability to support certain projects. So again, by alphabetical order, I would like to call up, and if we could hold our applause, these projects. One of these gentlemen you've already met today, and as Dr. Stobo said, in some cases, you don't wait. The evidence exists. So can Dr. Cannison come on up, please? This is a project that, if he's still here, you learned about on the panel earlier to expand ERAS to decrease post-op morbidity after major surgery. This is a major expansion at UC Irvine. And so we're very excited and very proud of your efforts. May I ask that Dr. Dillon, is Dr. Dillon here from UCLA? And I know some folks had to fly home, or do we have somebody who can accept on behalf of Dr. Dillon? Thank you. Okay, Dr. Dillon's project is a project to develop and implement a comprehensive procedure to address handovers or handoffs. Thank you. Did I say it well?
You said it very well.
Thank you so much. Okay, and is Dr. Fang here from UCSF? Do we have Dr. Fang? I love the smiles. Dr. Fang has a project to improve the management of perioperative use of anticoagulants during transitions and care. And thank you for your submission at UCSF. Is Dr. Lung here from UCSF also? Again, I wasn't sure if everyone could be here. Dr. Lung? Okay, I might ask one of our Dr. Fang if you can. This is a project to decrease delirium in high-risk patients. And this is an interdisciplinary project with our nurses as well. I know Greg Maynard cannot be here, but Greg Maynard from San Diego, one of our PIs from several years ago, has a new project, which will also, this one will take place just at San Diego, to optimize care of the surgical patient with hyperglycemia. So we're very excited to robustly support this project at San Diego. Is Dr. McLaughlin here? Dr. McLaughlin from UCLA? Okay. Dr. McLaughlin has a project to deliver values-based care for neurosurgery patients at UCLA. Forgive me if I say this wrong, Dr. Noblet from UCI? Okay. This is a project, and Bill, if you'd like to accept for Dr. Noblet, or just make sure that, thank you. Dr. Barron is the CMO, and I know we're justifiably proud. This is a project to improve communication and perinatal outcomes with standardized handoffs at UCI. And is Dr. Walensky here from UC Davis? Don't know if Dr. Walensky. Al, would you like to come up and? There you go, Carol Robinson, our CNO and CMO from UC Davis. This was a very well-received project from UC Davis to co-manage geriatric patients and reduce hip fractures at UC Davis. Now, one of the things, while Carol and Al are coming up, this was a project, you may have guessed, specifically designed to reduce the risk of clinical harm for our peri-op patients. And you may look at this wonderful, wonderful group that this represents and say, there's some surgeons, but not all surgeons. And one of the things, and look at that wonderful smile from Al, we're so proud of, is these interdisciplinary teams between our neurosurgeons, our hospitalists, our anesthesiologists, our nurses. This is exactly what we're looking for. And in some cases, we called a few of you and said, we're willing to fund you. We want to see the names of your surgeons before the funding takes place. We believe we know what it takes. And we're just so proud and delighted for all of you. So this is our time to applaud for this great group. And I do want to say, if there are others of you in the audience, or when you communicate with your other colleagues who did not this time get an award, believe me when I say, when there is another round, we don't, like some funding groups look poorly at second-time applicants. We do not, because we believe that as the proposals get stronger and stronger, and the right kind of people are brought in to the proposal, and you've built the support up, either in your institution or other institutions, and you've helped us with that work, we are very inclined to take another look at the work. So again, this has been a wonderful partnership with Terry. I just feel like this is the partner.
Well, I think it's a great partnership with all of our
Exactly.
facilities and the staff at all locations, as well as between our departments.
Yeah.
So go out there and break down silos.
Thank you, everyone. Have a wonderful weekend, and thank you so much for coming today.